so excited, So just bear with me. Let me just make sure that all the. Okay, so I think we are ready now. I've gotten rid of all the background noise. So I'll just go straight into the first question so that it will probably allow you to introduce yourself. So because it's Neurodiversity Week, my community is traveling beyond the label, and we are a community of parents and carers to neurodivergent children of different age groups. And our purpose is really just to continue to share knowledge, help each other along our respective journey. So thanks again for joining us today. So the first question is just a way for you to probably introduce yourself to us. So what role do pediatricians play in supporting families with neurodivergent children?
Okay. Good afternoon. My name is Grace, and I'm one of the training pediatricians in the UK. So I've worked in general pediatrics, and I'm currently in community pediatrics, which is a specialty that deals with neurodivergent children. So the role the pediatricians have basically is to help in identifying if there's a problem or not. And if there is a problem, we would be involved in screening. After screening, be involved in an assessment. And after assessment, would be involved in management. And more importantly, it's in signposting to the relevant help that is required. So when I say screening, the children have a vast variety of how they behave, which the community sees as normal. And then we have the neurodivergent children who behave in a way that they can or process information. They think, they learn, they feel, and they process things in a way that the community that is not what the community would term as normal. So they are the neurodivergent type. And the concerns might come from different sources. Sometimes, most times, parents would pick up the concern. Sometimes the school teacher picks up the concern and refers to someone in school. Sometimes the GP picks up these symptoms or these presentations, and then a referral would be made to the community pediatrician. And then the community pediatrician would have to review this child in clinic, and based on that review, we would decide if we should send in for a referral or not. So when a referral is now made, there is a screening assessment that would be done. In that assessment, before the assessment, the parents are given some questionnaires to fill. The school is given questionnaires to fill. So we gather information from different sources, and this information, as well as reviewing the child in clinic, would help in the initial screening. That screening basically rules off medical causes of similar presentations. And when that has been ruled out, then we'll think about a neurodivergent condition. Now, there are different types of neurodivergent conditions. So it's at the end of that screening, we would know if we would refer you for an assessment or not. If the pediatrician who's seeing thinks we don't need to refer for an assessment, at that point, the pediatrician is going to signpost you to relevant helps. So sometimes the parent might think the child has ADHD. Sometimes they think the child has autism. But at the end of the screening, the pediatrician does not think the child has any of these two. But the child might have some other problems like problems. And so what the pediatrician would do at that point is to signpost you to the relevant websites, information leaflets or support groups or professionals that would be able to help at that stage. Sometimes all the child has is anxiety. And that was misinterpreted as a neurodivergence. And so it would be referred to a psychologist or a psychotherapist at that point. On the other hand, if they agree with the referral that it's likely a neurodivergent condition we're dealing with here, then a referral would be made for an assessment. Now, that assessment is not done by one person. It's a multidisciplinary team that has both nurses, psychologists, medical doctors, and a vast range of professionals who would now have a detailed assessment of the child at this stage. Sometimes questionnaires are filled, sometimes computer-based tests are done. There are different things that will be done at that stage. And at the end of the assessment, a diagnosis would either be made or you'd be discharged that you do not have the condition. And if a diagnosis is made, then you have to come back to the community pediatrician who now continues with the management of the condition that has been diagnosed, or a diagnosis is not made. And again, you are signposted to the relevant supports that will be necessary to support what the child has at that stage.
Wow. It sounds like a long process. Some of the challenges that many parents like me, raising two neurodivergent children that have actually gone through this whole process is how long it takes. And I can, even from how long it took you to explain, I can almost sympathize with, how long the process takes because of all the people that are involved. And I really want to applaud your great work. I mean, I know different parents, different families have different experiences with professionals. I personally do my best, in spite of some of the not too pleasant experiences I've had, to applaud you all for the effort you are putting into supporting our family. So thank you for your hard work. And you mentioned that one of the people that can, kind of identify that their children are, kind of not presenting in a way that is typical is parents. So what kind of tell signs can parents look out for that can help them that can prompt them into action? What are the quick signs that you think parents will be able to quickly identify so that they can start the process early?
So commonly it depends on the condition, but
Mm,
typical presentations that we would see are things like having anxiety around strangers. So some parents would talk about whenever there's visitors, the child tends to leave where the visitor is and
mm,
go to their room. They talk about child not wanting to interact with other siblings in the house, but would rather be at home. They
mhm,
talk about obsessive behaviors like things have to be done this particular way. If it's not done that way, then they go into a tantrum fit and then there's problem in the house. They talk about difficulty adjusting to changes. For example, there was a plan to go to a museum. Like
mm,
one of the patients that came last week, the mom said there was a plan to go to a museum or something, and that day she started having her period.
oh
And so
dear.
she had abdominal cramp. And so the
Wow.
parents canceled the plan to go out. And then there was a large fit because there's a change to the plan she has already made for the day, even though the change was because of her own health.
Health.
And
Wow.
so things like hyperactivity as well, child is always on the go, cannot be stopped. Difficulty having friends,
Mm,
difficulty focusing on one activity. So they're always from one activity to the other, one activity to the other. Now, that is typical of a lot of children, which is the reason why we get a lot of concerns from parents. And then we have to go through the different questionnaire to actually see if the child fits the diagnostic criteria or not. So
mm,
commonly, the common problems would be problems with social activities and interacting with others, especially friends,
mm,
communication problems. Most times they do not have eye contact.
mm,
They would rather speak with as few words as possible. So they won't be able to have a two-way conversation with their parents, or they
mm,
would provide a very one-way, as short as possible answer to
mm.
most of the questions the parents are raising to try to have a conversation. Or they could have hyperactivity, inactivity, inattention, or some obsessive behaviors.
Wow. I think that gives a long list. And as you were just saying it, I was just mentally remembering my own journey at the beginning as well. Almost like check, yes, hyperactivity check. It's great that someone can laugh about it, but it's really it's a
Struggle,
challenging journey.
struggle at the beginning.
It's a challenging journey, but I think for me, the parents that I meet, I try to remind them that it's a journey. It's okay for it to feel like a like an impossible task, but it gets better. That is the message. It gets better. Thank you so much. I think that's you've given us a lot to go with, and you mentioned like hyperactivity. You mentioned one of the key things I think parents, when I think about myself, and the things that kind of prompted me to go and start looking for help for my son was things like delayed milestones. my son did not learn to speak on time, but I do understand that there are some neurodivergent children that gain language on time. So what advice, because like I mentioned before, our community is a community of parents. What advice will you give parents to support their children in the cases of delayed milestones, bearing in mind that all children have different unique styles? Because like you said, it's not everything that is neurodivergence, even though it might suggest it. So how will parents be able to make that distinction when it comes to their children meeting certain milestones?
So first of all, a lot of times what parents think is delayed milestone is not delayed milestone medically. So you see parents coming in like, my first child was able to walk at 9 months and this one is 12 months and has not walked. And we're like, well, we won't call it delayed walking until 18 months. And so at that point, we'd send you back home to come back. But usually what's advised is prompt presentation to a medical professional for a review. And when the medical professional reviews, at that point, they would be able to tell you if, yes, we think there's a delay, or no, it's not yet time for delay. A child still has a few months or 6 months or a couple of months to wait before we would term it as delayed presentation. And in the meantime, while waiting for it to get to that point, parents can support, like basically encouraging there are different. The problem with saying delayed milestone is there are different aspects to the milestone. So we have the gross movement milestone, which is different. So with that, you could help this child with holding the child to walk, providing like holding the hands, giving that support for the child to be able to walk, helping the child to have the confidence to walk. We have the delay in fine skills, like not use inability to use the fingers on time. And so with that, playing videos that shows children doing this activity or like playfully doing it and showing to the child could help. With things like communication, that is where a lot of people say, oh, we are having communication problems. And so usually if there is a concern and it's presented to the medical, we would promptly refer, if there is actually a concern, prompt referral to something like a speech therapist would be done. We would want to do a medical evaluation to check that there's no medical cause like a tongue tie or a problem with any of the airway or the passages that is involved in providing voice. And after that, we would want to do the when medical causes is ruled out, speech and language therapist would be referred, play therapist as well. They would all be able to, there are different plays they do with these children and gradually introduce them, and sometimes they start speaking. So the first thing is prompt presentation for review. And if there is no concern while waiting, you'd be encouraged, advised, given information on things you can do to support the child while at home, or you'd be referred to the professionals who would be able to provide professional help for the child. Sometimes we need to do investigations like blood work, imaging, like those that can't work, we might need to do x-ray of the hip to know why it's not working. And there are a lot of tests that might need to be done if appropriate, but if it's not appropriate, you might not have investigations done. You might just get referred to another specialist.
Wow. I don't envy you, You see, that's why I like to talk to professionals, because when you hear when you hear the way the process involved, and we just have to sympathize. But I know that those of us in that journey right now, we're not thinking about the work. We are just emotional about everything that is happening. But hearing the process that is involved is just amazing. Thank you so much for sharing that. In your experience, what would you say are I know that neurodivergence is big, it cuts across different conditions. But what would you say are the most common, if you want to pick a few, most common health challenges that neurodivergent children face?
The commonest I would say I have seen is mental health problems.
Mental
Things
health.
like anxiety, depression, low self-esteem. So these are the common, especially with teenagers or pre-teenagers. These are the commonest things they present with, and they would be referred appropriately for the psychological support they need for that. Other than that, we have what we call comorbidities. So some neurodivergent conditions present with a medical condition. Like you could see a patient with Down syndrome, they would mostly present with autistic spectrum disorder. So apart from the ASD or autistic spectrum disorder. We have the medical side, like the Down syndrome, which might be a heart problem. It comes with learning disability and the rest of it. So the comorbidities, the other medical condition that exists in association with the neurodivergence condition. Other things are things like behavioral concerns. And that is common in ADHD, where they are hyperactive and very inattentive. By the time they grow up and they start getting to that teenage years, they start having antisocial behaviors, disruptive behaviors. They are very known to the police in that area because they cause a lot of trouble and the police gets them home and all that. So that behavioral problems come in. And then some of them have sleep problem, difficulties sleeping, and a lot of parents struggle with that as well. Some of them are picky eaters, so they
Like
don't
I
like to
read.
eat. And then they go through nutritional difficulties and they have to go through the nutritional rehabilitation, and parents have to face that as well.
So it's like our work is cut out for us. You mentioned sleep difficulties. I think if you don't mind touching on that, because this is something that has been mentioned within our community. For some of our children, they are experiencing sleep difficulties. So what strategies or interventions can parents use to support children with such difficulties?
Okay, so from what we've done so far, so basically the first advice is to have a sleep routine.
Sleep
So they
routine.
advise to have a time when screen goes off.
Mm,
They would have their, depends on what they want. Different households have different sleep routine. But basically it usually evolves around making sure all screens are off at that time. Child has the evening bath
mm,
and has already had their last meal for the day. And
mm.
then the child would go into bed. Another concern that some parents raise in clinic is when it's bedtime, after the child has been put to bed, that's when she remembers she needs to drink water before she goes to sleep. And after drinking water, she remembers she needs to pee before she goes to sleep. And so the advice is, as part of the sleep routine, everything else you think you need to do before you eventually wind down for the day, you put it as part of your sleep routine. So if you want to have your bath, fine, you have your bath, change into your pajamas. If you think you need to drink water before you go to sleep, then go have your water at that time. If you need to pee, make sure you go and pee before that time. And so by the time your sleep routine is done and you're going to the bedtime routine, you're actually in your bed, in your room. And the advice for bedtime is to try as much as possible to be lying on your bed with the lights either turned off or you have a dim light on. No screens at all. Some children say they love soft music, like the sounds that can put them to sleep. For other children, they say they prefer to read. So they'd say read something that you'd eventually doze off from there. But try not to be thinking about the day that just passed or the day we're about to get into. Just lie down there, not thinking about anything, and most times the sleep would come with that time. So lie down, dim or no light, no screens at all. You could either be reading a book or listening to calming music, and that usually helps
Mm.
puts to sleep. We would try these two first, and if that doesn't help, then we would go into medications, where medications would be prescribed to help the child go to sleep. So at that review, would want to know, is it difficulty going to sleep? But once the child sleeps till morning, or is it that the child sleeps, wake up, sleeps, wake up, sleeps, wake up? Most times it's difficulty falling asleep, but when they eventually sleep, they sleep till morning. And so at that point, we'd be able to give a medicine to help put the child to sleep on time. And then when you've taken that medicine for a while, you'd have to come back for a review so we know if it's helpful or if we need to change it to another medicine. So typically that's the stage we go through with those who struggle with sleep problems in clinic.
Wow. Wow. I mean, and that's just one. That's just sleep. Oh, you can imagine all the it is well. You also mentioned things like behavioral management, because I really want our parents to get advice. What are the things we can do at home? I'm a big advocate of, yes, the perfect that professionals and our doctors can support us when we come and see them. But how do we manage things like difficult behavior at home what advice will you give to parents and for those that are also having challenges with nutrition as well, with their picky eating?
So with behavioral problems, there are two approaches to managing behavioral problems, especially here. The first one is a behavioral therapy for the child. So the child will be referred to a therapist or a psychologist who would do some talk sessions and try to work on the child to try to calm the behaviors. That is for the child. For parents, there's parental therapy as well, where parents go in and they're taught how to respond to children who are acting in certain ways. So if the child starts acting this way, this is how we want you to behave. No beating, no screaming. This is how you should do. Um, Basic like the parenting styles in Nigeria, as you know, is different from the parenting style here. And so you can't bring the flogging and all of that from Nigeria. So there's certain techniques which parents are taught, like, no, you can't do that. If you do that, take it to the naughty corner and things like that. So basically they are specialists, therapists who are known to be behavioral specialists. And at that point, both the child, the parents, and other siblings in the household would be referred to therapy. So the therapy the child gets is about how to calm their behavior and make them act normal, or at least act as normal as possible. And the therapy the parents and other siblings will get is how to cope or how to adjust or how to live with this person who has this problem. So that's that for both of them. And then the other thing parent could get is to get connected to other families who have children with similar problems. So they would share experiences and they would share learning points as well. So sometimes they have like focus group meetings where they'd be like, oh, I struggled with so and so my child today. And another child be like, oh, my child had that a few years ago, and this is what we did. This is what we were advised to do. This is the book. This is the leaflet we use at that point. And that provides support for that family at that point. Alternatively, there are support groups for like ADHD support groups, ASD support groups, where you could also get information. And we also refer to government help, like government websites where you can get government approved help. And some parents really, really struggle. It's like a 24-hour job for them. And those kind of parents have access to respite care, where there is a carer who's assigned to come let you rest for like 3 hours. It depends on how severe it is. Some parents get 1 hour respite help. Some parents get 3 hours respite help. Some get daily respite help. Depends on how difficult it is to manage the child. So they get this help as well, like a respite carer who comes to take over the child while you have your own rest as well.
Wow.
That's for the behavioral therapy. And for the eating disorders, they would be referred to the dietitian. So the dietitian would be able to advise, like some children say they have sensory problems, they don't like the taste of certain food. And so the dietitian will be able to advise what best to add to the food to provide the nutrients that the food texture you do not like has. And so for those with eating problems, usually the dietitian is involved and they would work and they would work with the child to make sure the child has the appropriate nutrient the child needs.
That is so useful. And you see, that what you have just said about nutrition ties into the next question. You see, the beauty of the internet age that we have found ourselves is we have all sorts of information out there, and in the bid to try and find help, we have all gone and seen all sorts of things. So this can be your personal view, can be your professional view, however you choose to interpret the question. What is your view on the role of nutrition in supporting development in neurodivergent children? Because there's been a prevalence of things like mental detox. There's been a prevalence of things like changes in diet. If you take your children off dairy, your child can start talking. I know some of these things are marketing gimmicks, but I really want to hear as a pediatrician what your view is on all these things that are heavily promoted.
So government recommendation or the guideline, the NHS guideline?
I would say the
Has,
NHS guideline. I think it's better to stick to
yes.
the
So the
guidelines.
NHS guideline does not support any of that at all.
Wow.
However, medically, we do know that we need the right nutrients in your system for the brain to be able to develop appropriately. So when you have the right nutrients, both your neurological system, your development, your immunity, and everything is going to be boosted to work in the right way that it should. So even though we do not encourage any of that, we do not completely rule off the role of nutrition in neurodivergence. So basically, what we would say is based on NHS guideline, no, there is no like detox or whatever that is recommended for you to do. However, all we would say is to optimize nutrition. If you have a balanced diet, you would have all the vitamins, minerals, and micronutrients that is required to have optimal brain growth and development. And so, we would say for to have the right nutrients that directly affects your body having the right building cells for the brain to grow and the right chemicals or neurotransmitters for the brain to work. And we know that these chemicals either upregulate or downregulate things like your mood, your focus, and your calmness. So if you have the right nutrients, basically a balanced diet composing of proteins like your meat, fish, eggs, and dairies, and the rest of it. We encourage lots of nuts, seed, fruits, vegetables. So all these would provide vitamins, minerals, amino acids, and fatty acids, which help the brain to grow and help provide the building blocks for the neurotransmitters, which are chemicals that help to either upregulate or downregulate your mood, focus, and calmness. But by the time you have a balanced diet, you should have enough of all of these in your system to work. So we do not specifically recommend any of those, but yes, we know that the balanced diet would also help in that direction as well.
You see why it's very important to follow professionals and not just follow Instagram influencers, because for people, families like us who have to deal with picky eating, like one of the things that my son eats is oats. And of course I try to put a lot of milk and things in it, because what other source of calcium, because I know he's a picky eater. And I know that some people have almost kind of, I will, out of lack of a better description, judge my decision to keep him on dairy and to keep him on eating oats. And I'm like, this is what he eats. Like, is it not better for him to eat something that not eat, if I now take that away, what will be left, So, and I know that there are a lot of families that are in the same condition as mine. So I'm very happy that the NHS guideline promotes having a well-rounded, balanced meal, And thank you for emphasizing that. And I think that's why it's good for professionals to really be behind all these things that are being promoted in social media, so that people have a balanced view. At the end of the day, people are still going to do what they are going to do. But at least if they are hearing from the professionals that this is what science and medicine supports, it's now left with the individuals to now decide, okay, what do we want to do? So thank you so much for bringing that into perspective. And in the same line of thinking, there's with all this AI and all the fancy things happening in the technology and medical world, a lot of people talk about innovative medical and therapeutic developments that parents can use to support their children. Do you have any kind of recommendations on how these innovative tools can assist us or not?
So currently, based on NHS guideline, there is no recommendation for any new. There's not been a recent update to the guideline to include any of this. There's some medications that are still in trial stage, so cannot be mentioned or cannot be used at present.
All these
But
stem cells, all these things we are seeing, it's still
so
not
those have not been
accepted.
included in NHS guidelines, so we cannot give them out as recommendation. When the studies are finalized and it's gone through the full, because for anything to be used in medicine, it has to go through the full vetting procedure, has to be tested in animals and then tested in humans before it is approved for use. And when it's being tested in humans, the people who are being tested know that this medicine has not been approved for use yet, but it's still in the trial stage. And so some things might still be in the trial. In maybe 5, 10 years or 15, 20 years time, these might have gotten the relevant approval and be incorporated into the NHS guideline. But at this stage, while they are still in trial form, they cannot be included in NHS guideline. They cannot be included as a medical recommendation for anyone until they've gone through the entire vetting process and they are deemed to be fit and safe for use before they would be included, and then we can actually recommend them for the general public to use.
So basically, we do so at our own risk if we go and
Yes.
embark on all this fancy stem cell. Like I always get all these ads about stem cell therapy, and I work in technology. I really understand that we must promote advancement, but I think there needs to be. It's good that the NHS guideline is clear so that parents are aware, and many of these things is out of desperation. We are just looking for a way to fix the problem. It's enormous, but I think we should also be very cautious in the things that we promote and things that we allow, because I've heard of situations where people go outside of the country. I don't want to start mentioning the countries, go out of the country for all these kind of interventions which promises heaven and earth, but I'm very happy that you brought that perspective that we should really be cautious. Hopefully, and I'm all about advancement. So if the next 5 years or 2 years or if they say that it is safe, I'll be the first person on the line.
Yeah.
I'll be the first person on the line. So thank you so much for that. Thank you. I think this has been such a useful conversation so far, Dr. Grace. I'm so happy that we were able to do this together. I think the remaining questions now, I'm mindful of time, is more about advice and that you can give to we parents. We've talked about behavior already. We've talked about milestones. We've talked about mental health being one of the most prevalent conditions that you see. So what general advice will you give to we parents that are supporting children, that are neurodivergent, no matter what the neurodivergent condition? What advice will you give to us to help us on our journey?
First of all, I want to say we all know that it's a very difficult situation to be in. And we all know that almost everyone would want a quick fix. Unfortunately, there's no quick fix. The commonest problem we have is the waiting time with the NHS. And so from the time the referral is put in to the time we actually get to see the community pediatrician for screening, sometimes takes up to a year.
Wow.
And from the time you get the screening review to the time you actually go for the assessment can sometimes be 1 year. And so we have times when parents would just keep calling, they want an appointment, they want a diagnosis so the child can get help. But would want to point out that you don't need a diagnosis to get the help you need for the child. So once we've identified that there's a problem, at that point, you're usually referred to other specialists who would be able to provide help. And so you don't need a diagnosis to get an EHCP for your child. If there's a problem, you could speak to the SENCO, that is the Special Educational Need Coordinator of the child's school. And any help that needs to be put in place at that time can be put in place. And the child can have the EHCP, that is the care plan for the child. It can be put in place without a diagnosis. So even though it's a long wait, you don't need the diagnosis to get all this help in place. And the pediatricians are usually very happy to refer you to professionals you need to see, to send a letter to school to say, okay, we're concerned about this. The child is still in the process. But can the child have 1, 2, 3, 4, 5 supports in place? So sometimes it's having patience to go through the process. But while you're having the patience to go through the process, we don't just leave you alone. You get the support you need at each of those steps until the diagnosis is made. Another concern is like for those who are severely, some parents are not able to go to work at all. And so to be able to be posted to where you can get help, financial help, to be able to run the home. And basically link up with other families, because you can't be an island with situations like this. It's very, very important to get the support of other families who have gone through the same. Different families are in different stages of the same process. So even when you're in that support group, you could be providing advice to those who are just starting. And there are others who are ahead of you who would provide advice to you as well. So it helps with networking and all of that. And I think basically that's it.
You
Just
see,
be patient with the entire process because it's not easy. I see them in clinic and I'm like, I don't know how they cope every single day. But like we had one that basically the dad had to mind the child while the mom speaks to us.
wow.
Because the dad said if he moves, the child might tear the record, might open the door and run out or something. And so dad had to completely man the patient while we speak with mom. So I know it's not easy, but then it's just to try to be patient and to engage and to request for help as much as you need to.
You see, Dr. Grace, you have summarized everything that we preach in Traveling Beyond the Labor community, and when this community was set up just a few months ago, after I wrote my book, A Champion Speaks, the idea of the community was burning so strongly because I knew how I struggled at the beginning of my own journey. My first son is 10, my second son is 6. At the beginning, I was just running helter skelter. But over the last few years, I've learned the importance of being a part of other people. And because of where some of us come from, our culture, it doesn't allow us to openly talk about some of these things. So it's important, like you said, to be part of a community. I'm not trying to promote my community, whatever community you can. You just need a place of safe where people understand what you are going through while you are navigating that journey. And just for me, some of the things that have changed my family is just hearing what somebody said worked for their child, and I've just picked it up and said, okay, let's try it out. And it has worked. In our community, we share things like, try this approach. If your son is not eating, try it this way. Turn it into a smoothie. If they're not eating veg, blend it. All these kind of ideas are what will help you along the journey. So I'm very happy that this is the kind of advice you are giving us. Um, and in the same vein of trying to provide advice, what resources, what websites will you say parents can also go to if they want to continue to improve their knowledge, you know, on how to support their children? Do you have any resources you can signpost us to?
So the reason I don't have any here
Mm.
is because usually it's different for each
Oh, yes, from
deanery, each
region. Yeah.
trust, each area.
Yeah.
So, like University of Kent would have the Kent University website, the Leeds Teaching Hospital would have the Leeds Teaching Hospital website, the Mid York's Hospital would have the Mid York Hospital website. So, usually, at the time you're seeing the pediatrician, we would usually give you an information leaflet. And on that
Mm.
information leaflet, you would find websites
Mm.
that has information on ASD. You would find support groups for that area. You would find telephone numbers you can ring for your
Area
locality. And they'd also find support groups of parents who have similar conditions
in your
in
area.
your locality. So usually we have a list we give out. So we give out information leaflets that explains everything. And on that leaflet, we have a list of websites and
Mm.
materials and useful pages to go to, but it's usually locality based. So I can't bring
And just give
the
us
one for the
general.
hospital I work for because it's going to be different from the one for the. So if you link up with the pediatricians or the community pediatricians to be specific in the
Mm.
locality where you are, they're always very happy to give out information leaflets. Sometimes they print it and keep it in the waiting room of the clinic. So
Mm.
at the back of the information leaflet, you would see websites, support groups, and everything, phone numbers, WhatsApp groups, things like that. So most of them are like QR codes where
Mm.
you scan, you join the WhatsApp group and things like that. But they are region based, so it's unique for each area.
I think that's more information, more than enough information for we parents. I remember when I think the summary of everything you're saying is, let's not just stay in our cocoon and try to figure it out. We need to talk. We need to access the community pediatrician. Healthcare is now within the community. You don't have to wait to go to a big hospital, refer to a big hospital. So I think the message is people need to access the services that are available within their locality, and also it's good that it's regions, centric. That way you don't have to travel far. Each region has its own services that you can explore. Then, of course, join all sorts of, support groups, support networks to help you There are some that are registered and recognized from the community aspect, and there are informal ones like us, Traveling Beyond the Label, which is just to provide emotional support. So, Dr. Grace, I think that's all we have time for today. I'm thrilled that you're able to join us, and I'm looking forward to my community meeting you on our next event physically. We need to draw from this wealth of knowledge. We need to draw from you physically. The Zoom thing is not enough. I know there's still so much we've not been able to explore today, and I'm throwing my faith out there that our next physical event next year will be able to bring you down to Cambridge. Come and
Hopefully.
join us.
Hopefully.
Thank you so much for taking the time, and my regards
You're
to you,
welcome.
William. I know that this is just the beginning of our relationship. And on behalf of my community, I say thank you for sharing your knowledge with us on this Neurodiversity Week. And I hope that you have a wonderful rest of the day.
I hope
Thank
you have a great week as well.
thank you
Thank
so
you
much.
for
I'll
having
be in
me.
touch again. Take
All
care.
right.